this day and raising public awareness about elder abuse. In addition to this webinar, we are preparing a county board proclamation to honor this special day. And in fact, the board has already taken that action and declared it so. We are also celebrating throughout the entire month of June by conducting several outreach events at community and senior centers in all 88 cities in partnership with Los Angeles County Commission on Aging and our law enforcement partners, and also partners in the banking industry and others in the community. Our goal is to inform all of the community about World Elder Abuse Awareness and the services provided by Aging and Disabilities Department. Pictures from these activities will be posted on our department website, so you're all welcome to visit later on our social media accounts, including Facebook, Twitter, LinkedIn, and Instagram. So if you're connected to those, please keep a lookout and look at our postings. We are also collaborating with the City of Los Angeles to light up Los Angeles International Airport pylons in purple, the official color of Elder Abuse Awareness Day. We want to tell the world that Los Angeles cares about older people, their safety, and their well-being. I strongly encourage all of you, if you can, on June 15th to wear purple to show your support of World Elder Abuse Awareness Day. Thank you for your dedication to serving the communities of older adults and people with disabilities. Next, you will hear presentations from representatives of our own Adult Protective Services program, line operations, program and planning divisions, our area agency on aging, and our disabilities division, who will speak to you about their perspective on the work and advocacy that we need to do as a community. So thank you again for making time to share today with us, and also to lift up the importance of making sure that older adults are safe in our communities. Thank you and have a wonderful webinar.
Thank you so much, Dr. Trejo. My name is Dave Kochen, and I'm a Human Services Administrator with the LA County Aging and Disabilities Department Disabilities Division. And so we are going to have some great guest speakers, but before we get into that, I'd like to give you a little bit of background about elder abuse in general. So elder abuse is officially defined as any knowing, intentional, or negligent act by a caregiver or any other person that causes harm or a serious risk of harm to a vulnerable adult. Legislatures in all 50 states have passed some form of elder abuse prevention laws. Many victims are people who are older, frail, and vulnerable and cannot help themselves and depend on others to meet their most basic needs. Abusers of older adults are both women and men and may be family members, friends, or trusted others. The National Council on Aging reports that up to 5 million older Americans are abused every year, and the annual loss by victims of financial abuse is estimated to be at least $36.5 billion. And there are an estimated 202,549 cases of reported elder and dependent adult abuse per year in California. Next slide, please. Thank you. So what you see are the different types of abuse that are perpetrated against our older population, as well as people with disabilities. This includes physical abuse, sexual abuse, neglect, exploitation, emotional abuse, abandonment, and self-neglect. Self-neglect is often forgotten or not even known about as a form of abuse against seniors. Self-neglect is characterized as the failure of a person to perform essential self-care tasks, and that such failure threatens his or her own health or safety. And it's not reported because it's a very hard thing to come to grips with and to be able to admit to oneself. But it is very highly encouraged that if someone is experiencing these types of symptoms and the signals that they experience as part of self-neglect, that they also report to Adult Protective Services. Next slide, please. It's very important to recognize abuse and to recognize the warning signs of elder abuse. This this really speaks to the prevention side of APS. And so a sign doesn't necessarily indicate abuse, but some telltale signs could be a problem. And they include bruises, pressure marks, broken bones, abrasions, and burns. But then there are also slightly more subtle symptoms of it, including withdrawal from normal activities, a sudden change in alertness and mood, unusual depression, sudden changes in financial situations. That's extremely important to look out for because it may indicate that someone is taking advantage of someone financially. Bed sores, unattended medical needs, poor hygiene, unusual weight loss also are indicators. Behavior such as belittling, threats, and other uses of power and control by spouses or others are indicators of verbal or emotional abuse. And then, of course, strained or tense relationships, frequent arguments between the caregiver and elderly person are also signs. What can be done to prevent abuse? As I mentioned earlier, what's really important is to see what we can do to prevent abuse as opposed to just react to it once we are aware that it is happening. Family members and caregivers can take steps to prevent abuse by staying connected with their loved ones, watching for signs of abuse, and reporting any suspected abuse to appropriate authorities, including Adult Protective Services or law enforcement, or both. It's important to check in on your older adults who may have few friends and family members. By prioritizing elder abuse prevention, we can work to ensure the safety and health of older adults. So a big part of World Elder Abuse Awareness Day is it's a call to action. It's not just a way of commemorating, it's also trying to raise public awareness and getting people to act. So we encourage all individuals who know about or suspect abuse to report it. This includes calling 911, local law enforcement, and adult protective services. It also includes efforts to raise public awareness of abuse. As Dr. Trejo mentioned earlier, it's one of the things that we encourage is to wear purple. Purple is the official color of World Elder Abuse Awareness Day. So please wear purple and encourage others to do the same. And then advocate for legislation regarding prosecution, funding, outreach, etc. In the last 20 years alone, there has been a lot of progress made in terms of increasing the punishments and penalties for elder abuse. Next slide, please. And this is just a list of some of the elder abuse resources that we have here in Los Angeles County. Adult Protective Services, law enforcement agencies, the LA County District Attorney, the Department of Consumer and Business Affairs for financial abuse, including fraud, and that also includes real estate fraud. And then the Department of Mental Health, which includes the Office of the Public Guardian. They conduct conservatorship investigations, as well as Genesis, which is an agency that does mental exams to determine the cognitive capacity of our APS clients, as well as the Department of Health Services and the Center for Excellence. So a very important and even fun campaign promotion that we are trying to encourage people to take part in is called Finish the Sentence. So people of all ages can champion elder justice. Participation in our Finish the Sentence campaign to encourage everyone, regardless of age, to stand up to elder abuse by raising awareness, promoting education, and advocating for the rights of older adults. It's actually very easy to do, and it's actually pretty fun. So what you do is you can download the template, can do it in one of the 4 languages listed: English, Spanish, Chinese, and Korean. And what you do is you finish this sentence. Everyone at every age can stand up to elder abuse by, and then what you do is you spread the word by capturing a photo with your finished sentence and sharing it on social media using the hashtag WEAAD, WEAAD, which stands for World Elder Abuse Awareness Day, and or upload it to the Dropbox. And then you can also start conversations, discuss the campaign, share resources, and engage your community to participate. And so with that, we are going to now get into some of the programs and services that our department provides. And we're going to have some representatives from our department speak about those programs. So we're going to begin with Adult Protective Services line operations, and I will turn it over to Bernadette Andrews, who's a Human Services Administrator too. Thank you so much.
Good morning. Yes, thank you, Dave. Hi, good morning, everyone. I'm Bernadette Andrews, and I'm with Adult Protective Services, and I'm here to share some information about our program with you. Next slide, please. APS investigates reports of abuse, neglect, and exploitation perpetrated against older and dependent adults. APS investigates approximately 5,000 to 5,500 reports every month. And we have a side-by-side comparison here of fiscal year 21-22 compared to 22-23, which you can see that there was an increase in APS reports from 55,186 to 59,301. Of those in 22-23, 42,674 actually became APS investigations. 31,979 of which were reports for older adults, and 5,960 were reports for dependent adults. Next slide, please. This just explains a brief overview of what APS social workers do. Our social workers interview and investigate, which includes a face-to-face visit with the client, abuser, family, collateral contacts, as well as witnesses. Our social workers assess, which includes an assessment of the client's major risk factors such as functional abilities, cognitive functioning, mental and emotional health, environmental factors, medical care, support system, and finances. Our social workers will then develop a service plan and intervention plan for our clients, which includes interventions and strategies to resolve the client's problems. For example, cross-reporting to law enforcement or referring to mental health services or providing housing resources. Our social workers will also reassess the service plan if the abuse and neglect continues, and will adjust the service plan accordingly. If the case is resolved, we will proceed either with closure or referring to another agency for further assistance. Some of the services that we provide to our APS clients include, but are not limited to, home delivered meals, family caregiver resources, in-home supportive services, emergency food vouchers, transportation services, mental health evaluations, which we do refer out to the Department of Mental Health, as well as resources for health insurance and counseling and advocacy, legal aid referrals, and tangible support devices. Thank you, Dave.
And now we will have Francisco Wong to talk about our APS program and planning services. Thank you.
Good morning, Dave. Francisco Wong from the APS Program and Planning Division. Next slide. So at the APS Program and Planning Division, what we do is we are responsible for providing and developing policies for our social workers. So anytime there's change in APS policies or laws from the state, federal, or county policies, then we will go ahead and draft our policies to be issued to our social workers regarding changes to the program or any business procedures. We also have our APS Center of Excellence. Our Center of Excellence is a comprehensive multidisciplinary team that starts discussing cases that are recommended to be handled or to proceed with prosecution. This is a specialized MDT, multidisciplinary team that meet and we try to just be able to assist our clients at another level when the social worker is requesting further assistance with any of their cases. Our APS Integrated Care Services Program, this is a program where once a social worker has arranged any necessary services and stabilized the client's immediate safety, then the social worker will submit a referral to one of our providers to assist the client either with financial stability, housing related issues. Also, if the client might need assistance with maintaining adequate health care, or if the client might need assistance with activities of daily living. Next slide. In our section, we also have our staff development training unit, which provides the training to our current APS staff and also our new social workers. Anytime we have new APS staff, our training unit will provide the trainings to that staff. We also oversee our APS records requests. So when we get records requests, either by subpoena or client requesting records, we will take the information and have a conversation with our county council to review whether records can be provided to the party. We also have our emergency food voucher program. In our food voucher program, when the client is in need of food or unable to obtain food, then the social worker will provide a gift card to the client, and it's a groceries gift card to the client to be able to buy food. In our division, we have the APS Home Safe program. Our Home Safe program assists our APS clients with short-term prevention, also housing stabilization. If the client needs assistance with paying the rent, assistance with moving in, or assistance with utilities, then we will go ahead and assist them with those services. And I have an asterisk on some of our programs. It's provided to the extent that funds are available. And that's it for me.
Thank you, Francisco.
Thank you.
And now we will turn it over to Mike Gavigan, who is a Human Services Administrator 1, who's going to talk about our Area Agency on Aging. Thank you.
Thank you, Dave. Good morning, everyone. Good day. Mike Gavigan with Area Agency and Aging Program Division. I am a Human Services Administrator and oversee several programs in Area Agency and Aging. We're going to give you some information on who we are and what we do. But before we do that, I'd like to just briefly list the services that we provide to the County of Los Angeles. And those include Dignity at Home Fall Prevention Program, Disease Prevention and Health Promotion, a health insurance counseling advocacy program, also the long-term care ombudsman program. In addition to that, there's also the senior community service employment program, the elderly nutrition program, a linkages program, as well as a supportive services program and a family caregiver support program, and also a legal assistance program. We also provide advocacy and information assistance to the community that we serve. If we can move to the next slide, please. This is information on who we are in terms of AAA and what we do. Our programs are federally funded, as established and funded by the Older Americans Act of 1973. The purpose is to coordinate and deliver aging services and to provide assistance to older Americans and their caregivers. The states are divided into regions. So in the state of California, there are 33 planning and service areas, or PSAs. Each PSA is served by its own AAA. Currently, for your information, there are 2 AAAs in the county of Los Angeles. Los Angeles is the only county in the United States with 2 AAAs. What that means is there's basically a PSA for the city of Los Angeles, known as PSA 25, and there's also a PSA for the county of Los Angeles as well. All of the services that are provided either through the city or the county are the same. Just depends on where you reside within the county of Los Angeles. If you reside in the city of Los Angeles, you receive services from the city. If you reside outside of the city of Los Angeles, your services will be provided through the county of Los Angeles. We're committed to help older adults age in place with dignity and independence, and our purpose is also to ensure the safety and well-being of older adults in long-term care facilities. These programs also include components of planning, development, coordinating, and delivering services. Next slide, please. This is also some information in terms of who we are and what we do and how the services are provided. This is basically a map of our providers throughout the county of Los Angeles. For some programs, there is one service provider that covers the entire jurisdiction for the county of Los Angeles AAA. And other programs, particularly our home delivered meals programs and also our congregate meals programs, Those are provided by several service providers. Nonetheless, all of our service providers provide the same level of care and service to all of our clients. So we make sure that everyone receives the same level of service. And also do want to mention, in terms of eligibility, there are no fees for these services. These services are free to County of Los Angeles residents. So there are no income requirements or fees for the services. And to apply for those services, we request that clients contact our Information Assistance Unit, which is at 1-800-510-2020. Also within AAA program, we have an advisory council. In the PSA 19 program, this includes the Los Angeles County Commission on Aging, or LACOA. Their purpose is to provide advocacy, and they increase awareness of the Board of Supervisors regarding issues, conditions, and the needs that face older adults in the community. The Advisory Council also makes recommendations as to how adverse conditions might be remedied. As they are an advisory council, they advise the AAA on aging programs to help develop and coordinate community-based systems of services for all older adults in the County of Los Angeles. They also provide information on ordinance changes per motion, Los Angeles County Board motions. They also provide those recommendations, and also the program was recently reduced from a commission of 50 to 25 LACOA members in our advisory council. So we definitely appreciate their insight and their contributions in terms of how we can better serve the community.
Thank you so much, Mike. At this time, I'd like to give you a little bit of background about our Disabilities Division. We have a number of specialized programs that we administer as part of the division. To begin with, we have an innovative program called LA Found. There was an initiative that started the program, and it's to help caregivers of those living with Alzheimer's, dementia, autism, or other cognitive impairments. The idea of LA Found is to help those individuals who go missing, individuals who tend to wander. A lot of the individuals who have Alzheimer's, dementia, or autism tend to wander away from their home or somewhere else. So in partnership with our Sheriff's Department, the idea of LA Found is to help find these loved ones. The way it works is that there's a voluntary system of free trackable bracelets for at-risk individuals. When an individual wearing a bracelet goes missing, the Sheriff's Department deploys a specially equipped team to assist with search and rescue by tracking the device. And now we're moving into more advanced technology using Global Positioning System, or GPS technology, through the use of tracking devices manufactured by a company called TheoraCare and using the Clairvoyant networks. So another program that we have is the New Freedom Transportation Program. This provides transportation throughout all of Los Angeles County to adults 65 and older and adults with disabilities. One of the components of the program is the Volunteer Driver Mileage Reimbursement Program, which is also very innovative in that it's client-centered. It gives participants the opportunity to select and designate one or more volunteer drivers for their transportation needs. So it's basically somebody that they actually know. They can be selected from individuals including family, friends, caregivers, or neighbors. And so the slogan of New Freedom is keeping you on the move. And it's very easy to apply for the program. You can either call at the number listed, you can email at the email address listed, or you can go to our website. And then another program that's part of the Disabilities Division is Information and Assistance. One thing that we're always trying to do is raise public awareness about our programs and our services. It's extremely important because there are so many services that are available to the public that people just simply don't know about. And when they hear about them, there's a lot of relief and a lot of satisfaction. So included in the INA, or information services, are the phone and email services that are available to members of the public about programs that are available to older adults people with disabilities, caregivers, and others. In addition to that, we respond to requests directly from our LA County Board of Supervisors to assist constituents who have contacted them regarding services available to the community. And perhaps most importantly, we reach out to the community. We represent the department at outreach events throughout the county to raise awareness of available services and older and dependent adult abuse in general. And then we also have our LA County Commission on Disabilities. This is the commission that advises the Board of Supervisors on a number of issues affecting the lives of people with disabilities. They're an advocacy group. They take action to achieve a barrier-free county where people with disabilities have equal access to programs and services. There are a number of areas that the commission focuses on, including employment, education, diversity, health, housing, transportation, access, and recreation. The commission also monitors the quality of municipal services and evaluates policy and recommends improvements and other changes to existing laws. And it's been very effective and very successful. And so there you have it. This is all of the different programs and services that we provide. And at this point, we'd like to open it up to you for any questions that you may have. I believe that what we can do is open up the chat box, and I think a number of people have already been asking, will this presentation be available? And yes, I believe we're going to be able to put the link directly into the chat box for anyone who's interested. So at this point, if you'd like to ask any questions to any of our panelists, we'd be very happy to answer them. Thank you.
Excuse me, before we go to that, there's one additional question in the Q&A area, which is, will the recording be sent out to all participants?
So yes, we can absolutely do that. We will send a link to everyone who has joined, and we're very happy that that you could join us. So yes, we will provide that to everyone.
There are no more questions and are answered questions in the actual Q&A area, but I would like to encourage all of our attendees, please go to our YouTube channel. Every webinar that the Aging and Disabilities Department hosts is made available on YouTube within 10 business days. That's the best place to catch up on any webinar, to see what the department is doing. We also invite you to follow us on our social media accounts. We do have LinkedIn. We are available on Facebook, and we're also on Instagram. But the best place to find all past webinars is our YouTube page. Thank you. At this time, we'll look at the chat box to see if there are any questions. There are none. So, Dave?
Yes. So thank you, Delora. So we're actually going to give you back some of your time. I think the main message that we want to spread to everybody here is to spread the word, to really take a good look and do some research on your own about World Elder Abuse Awareness Day and all of the different things that you can do to prevent elder abuse and abuse against people with disabilities. Look at a lot of the activities that are being conducted in honor of World Elder Abuse Awareness Day. And finally, once again, wear purple, the official color of World Elder Abuse Awareness Day. Thank you so much for joining us. We really appreciate it. Take care.